Okay, so now we will discuss about Reye syndrome. Here, Reye syndrome, another name is Jamshedpur fever, and it is having an unknown etiology. So, what is the another name? Jamshedpur fever, and it is having an unknown etiology. Now, this is mostly affecting the pediatric age group. So it is in usually in questions you get a child is presented with so pediatric patients, and also they will have a viral illness or there will be a history of aspirin injection like that. So you can it is affecting pediatric patients, viral illness, or there can be history of aspirin injection. So what are the clinical features that you can get here? It is increased intracranial pressure, vomiting, increased intracranial pressure. So sometimes it can be just like cerebral edema can be presented like that, and vomiting. Also sometimes it can be comatose because of hepatic encephalopathy. Okay, so now we will learn in detail about this. So here the mitochondria in the liver is getting damaged. So certain metabolism which is happening in the liver, that will get disrupted. So there will be increase in ammonia. Then what happens? It can cause hepatic encephalopathy. Okay, it can reach the brain, and therefore that is can be manifested like cerebral edema, coma, like that. So in another feature that you can get here, so in the lab investigation you can find that there will be increase in the ammonia, and also there will be hypoglycemia. You can observe in lab investigations. Okay, so now we will see what is the microscopic examination of Reye syndrome. In this picture you can see the microscopic examination of Reye syndrome. So first one, it is in the light microscopy, and this is in the electron microscopy. Okay, so in the first picture you can see a lot of vacuolated spaces, isn't it? So that is microvesicular steatosis, and it is a non-specific finding. So because of the intracellular accumulation of the triglyceride, you are getting a lot of fatty vacuoles. So that is microvesicular steatosis. Now in the electron microscopy you can see mitochondria, a lot of mitochondria like this. So we have already said that here the mitochondria is getting damaged, isn't it? So you can see them in different shapes. That means pleomorphic mitochondria. You can get them, see them budding or branching in variable shape, variable size, like that. Mitochondrial swelling. So all these are the findings that you get in the electron microscope. So in the questions and all, it is very important to remember this. First one, it is microvesicular steatosis, but it is a non-specific finding. At the same time, the electron microscopic picture is a specific finding of Reye syndrome. So that's all about Reye syndrome. Thank you.